Good evening, David Muir. Thank you for joining me here in Las Vegas. Darcy Spears here at KTNV. Can you talk to me a little bit about what you've discovered in terms of how the prescription drug issue is feeding the heroin epidemic? We've reported on countless people, legitimate pain patients, who can't get their prescriptions filled at local pharmacies. Is that pushing them out to the streets and feeding this heroin epidemic?
Well, I have to say, Darcy, we applaud all of your reporting there on the prescription pain pill problem, and you'll see it tonight. And authorities say there is a direct link. I mean, there's so many numbers, but here's one example. 4 out of 5 new heroin users began with prescription pain pills. And in so many cases, that's, the son or daughter on the soccer field, the football field with an injury, prescribed some sort of opioid, some sort of painkiller. Parents with pain pills still in the medicine cabinet. And this really knows no boundaries. You'll see it tonight. Rich, poor, middle class, all ages, but in particular, young people. And if they can get their hands on some of the prescription pain medication, once that runs out, authorities say if they have an addiction to opioids, they can find that same fix. And here's what's frightening: far easier, far cheaper on the streets, and that's the heroin.
And an expert that we spoke to, who unfortunately became an expert after losing his 19-year-old son to a heroin overdose, his feeling is that this should not be treated so much as a crime problem, but more as a health care crisis. Did you encounter anybody with those thoughts?
Yeah, I think that is a central question to tonight's hour, and I can't underscore enough how brave these families were to allow our cameras into their homes for more than a year. They were the parents who loved their children, raised them well, and said, "Not my child." And somehow this found a way in through the back door. And they allowed us to document their fight to save their young loved ones and to sound the alarm in their communities. And I think that you'll see that the power and the grip this has over these families is something that we all have to help them out with.
Speaking of families, David, there's a specific Las Vegas connection in your report. Tell us about how that worked out.
In so many of these families, there are young people affected, and then when they start their own families, if they're not able to break free from addiction, then you've got a child, a baby, who then, through no fault of their own, found themselves right on the front lines. And in Nevada tonight, you will see how our storyline starts, in one corner of the country in New England, ravaged by this. Suddenly we're in Nevada on the hunt to find solutions and to find a loved one, quite frankly. And you'll see a woman in Las Vegas who plays a central role. One of these typical stories of a loved one, a relative, a grandmother who has to jump in and try to save the family. And she's become an advocate, as so many people have across this country. Moms and dads who never thought this would affect them, now leading the charge, saying we cannot wait for the government any longer or for authorities. If we don't fight this, we're going to lose a lot of people.
Is it your understanding that authorities, because of the hyper-focus on a war on drugs, that they haven't legitimized the fact that this needs to be addressed in a more proactive way, in a more treatment way, as opposed to a criminalized way?
Yeah, Darcy, I think you bring up a really important point. I think law enforcement, and I went right to the Drug Enforcement Agency and we asked them tonight, can we really arrest our way out of this? And they're extremely honest with me. And they said, our answer is different from what we would have told you 10, 15 years ago, but they're quite honest, quite candid, that they can't do it alone. And in fact, it's no longer just arresting people. As you point out, it has got to be communities coming together to help treat this as a mental health issue, as addiction, and not something that you're going to be able to pick someone up off the streets and immediately solve the problem. It is far beyond that.
And there's a new face of heroin. It is not a homeless junkie in an alley with a needle sticking out of their arm anymore. These are your friends, your neighbors, your classmates, people that you wouldn't expect to become addicted to something with such a sordid past.
Well, this is one of the things we find, in covering heroin over previous decades. It was largely, a problem found in some of the big cities. And I think tonight you'll see that no community now is immune, that this is in suburban America, this is in rural America as well. No boundaries, young, old, rich, poor, parents who raised their children, they believed in loving and safe homes, and yet it still found a way to find its way into their lives.
from Las Vegas to New Hampshire, all points in between. We look forward to your year-long investigation and the special report that we've put together to go with it. David, thanks so much for joining us and for your hard work on this very important topic.
Thanks so much for teaming up with us, Darcy. We'll see you tonight.